to get all settled. Thank you so much for joining us. Great. So good morning again, everyone. My name is Danielle Walwyn. I am the Advocacy Officer at the Healthy Caribbean Coalition. And on behalf of the Lake Health and Wellbeing and the Healthy Caribbean Coalition, we are thrilled to welcome you to our part 2 of a 2-part session focused on branding, CSO branding, and effectively reaching your target audience. And last session, we would have really dove into branding and exploring what that looks like. And today we're really looking forward to looking at effectively reaching your target audience. We have quite the agenda for you today. Next slide. Great. So we're currently doing our welcome. So welcome everybody. And then we're going to dive into exploring social media and other digital strategies for NGO marketing, led by Sheena Warner-Edwards. We're going to dive into digital advocacy, led by Jill Greenberg. And then we're going to start to explore the media and our relationship as NGOs with the media and how key that is for advocacy. And then we're going to look at how we can apply all that we've learned from those presentations within case studies. And so we're going to hear from Dr. LeBlanc, and then we're also going to hear from Abby Bejo. So with that, I'd like to introduce the organizations who are leading this session today. So I'm actually going to turn it over to Teresa Herbert to speak about the St. Kitts and Nevis NCD Alliance, and then Abby Bejo will share about Lake Health and Wellbeing, and then I'll close with the Healthy Caribbean Coalition. Teresa, over to you.
Hi, good morning, everyone. I'm Teresa Herbert. I'm the project officer of the St. Kitts and Nevis NCD Alliance. And so we're just a cohort of civil society organizations who work independently, but we have come together to sort of try and help to push the agenda of reducing NCDs in the Federation of St. Kitts and Nevis. And we're doing that through a variety of ways. One, we promote sort of education, and that's mostly related to prevention of NCDs. The next is through supporting the current treatments that are being offered and seeing how we can improve those. And then lastly, through advocacy. We're currently working on an advocacy strategy so that we can have policies in place that support a healthy federation and decrease the impact that NCDs are currently having in St. Kitts and Nevis. So we have several organizations that are a member of the Alliance. That includes organizations that focus on breast cancer. There's a renal society. We also have a disability group that is present with us. And a few others. Lake Health and Wellbeing is one. So I will turn over to Abby, who will introduce Lake Health specifically. Thank you.
Okay, good morning, everybody. Such a pleasure to be here today and to welcome you to this webinar. So welcome, everyone. So Lake Health and Wellbeing, we're a public health NGO. We're based in St. Kitts and Nevis, and we aim to improve the health and well-being of our local, regional, and online communities. And we do that in a number of ways. So we carry out research to understand health needs, we implement public health projects, we carry out advocacy campaigns, and we organize health education events as well. And so one of the projects that we're implementing is the St. Kitts and Nevis NCD Alliance. And so basically we act as the convener and the secretariat for the St. Kitts and Nevis NCD Alliance. So that's just a little bit about us in a nutshell. And so now I'm going to hand it over to Danielle, who will tell you a little bit about the Healthy Caribbean Coalition. Over to you, Danielle.
Thanks so much, Abby. So everyone, the Healthy Caribbean Coalition is a network of civil society organizations that are really focused on the prevention and control of non-communicable diseases. So we look at the risk factors, and we also, we look at the risk factors, and we also look at non-communicable diseases themselves. We have a number of campaigns, and a big chunk of the work that we do is empowering civil society organizations to take control and advocate for NCD prevention control measures locally. So on behalf of all the partners, we're thrilled to welcome you. And again, the main aim of this capacity building session is to equip civil society organizations from across the region with the knowledge and tools successfully market their non-government organizations, NGOs, and reach their target audience with their key messages. And the hope is that by building a stronger sense of brand identity, that will strengthen our advocacy. And we know that we have CSOs across sectors. So again, we welcome you and we're really looking forward to meeting you. And so with that, I'm encouraging everyone to please introduce yourselves in the chat, your name, your country, the civil society organization, NGO that you represent. And if you're keen, your email address as well. In our first session, we would have had a number of civil society organizations that didn't know each other, but got to know each other through the session. So definitely encouraging you to include your email address. And so with that, we're going to dive straight into our first session by Sheena Warner-Edwards, who is the communication officer at the Healthy Caribbean Coalition. And Sheena is going to tell us about the different social media platforms and how we can use those in our marketing efforts. And so Sheena, we're excited to turn it over to you for the first session.
Thanks, Danielle. So good morning, everyone. Make sure I'm sharing slides. Okay. Let's go back. You can see, you're seeing?
Seeing Sheena, just not in presentation mode yet.
Okay, hold on. If everything for me switches up, that's all everyone.
Take your time.
Seeing it now?
Seeing it now.
Yes.
Thank
Okay, great. Okay, so let's get started. So for me and for ACC, generally we start with one. Who is your target audience? Because we're exploring again the use of social media and media, digital media in general. And depending on what your NGO, the focus of your NGO, or the aim, the reach, who you want to target, and this could be whether it's offline and online, you have to get a sense of who you are targeting. And this too may vary from campaign to campaign. So that's something to keep in mind constantly. Who you're targeting, but also where do they lie? So where are they located? Are they on Facebook? Are they on Instagram? Are they, just simply in the community? Because as we know, especially in some Caribbean countries, especially, there are persons who may not be, attached, or, they don't communicate generally digitally, but they may be in a rural community, and you still have to find ways and means of reaching those persons. Again, NGOs, as we know, we not necessarily have like the full teams that maybe the private sector or the large companies may have. We may just have one or two persons, who are controlling the digital media space. So again, you don't want to stretch yourself too thin. So in terms of that, you have to definitely sit down, retool, identify those platforms where your presence will definitely make a difference. And again, people learn differently. So it's always important, when you're strategizing, to identify how and what and where. So how you're going to target those persons, what you're going to use to target those persons, whether it be video format, whether it be graphic cards, whether it be polls, whether it be an article, maybe an article in a local newspaper or magazine. But these are things that you first have to, sit down and identify before you even get started. For us at HCC, we always start with a communication strategy. This could be a communication and advocacy strategy. So number one point, is your campaign going to be an advocacy related campaign? Is it going to be behavioral change? Is it going to be educational? So you're providing information where you see there are gaps and you want to fill. Then it's identifying your audience. Again, as we just spoke about it, is it that you're targeting policymakers? Are you trying to reach mothers, young mothers who may be, now breastfeeding for the first time? Or are you trying to reach men? As we know, men are usually our hardest to reach. Men, especially 35 years and older, these are things that you have to identify. And in doing so, you will also be looking at, okay, the types of materials that would reach these persons where they are. one key thing that we've always identified, and even more so now, is the importance of partnering. And so partnering, strategic partnerships with community leaders, community organizations, other NGOs, perhaps it may be, a community group, youth group that you want to reach. But partnerships are definitely, turning out to be very key, especially in the space of communication. And we spoke about tools. So tools in terms, we're speaking about videos. So videos, petitions, whether you're going to be taking that online media, which I'll speak more about, to the offline space and vice versa. You have newsletters, magazines. So there are many types of materials that you can use to reach people, but you as an NGO or NGO organization will have to determine, your capacity, but it's human capacity, and those tools that may be able to make it better or easier for you to reach those audiences. And then we look at our content. So for HCC, we do something called media monitoring. And in that, we're literally monitoring what is said within the health space across all media. So we're looking at articles, online articles. We're looking at sometimes television, because in some cases we're seeing a lot in the digital space presence. A lot of television type programs are being brought into, so not just on TV, but being brought into other digital spaces. So we have, say, TV programs on Facebook. We have them, pop-up ads that would lead you to a television program. We're also seeing pop-up ads that would lead you to campaigns that is advocacy related or not. So we are monitoring, and it has been a very key factor, because then we use, those keywords that are popping up. We use quotes that are popping up in our social media graphics or digital graphics. We're using that material to create content. So that is another key factor. And then, of course, your outcome. So from the very beginning, you're thinking about your outcome. What is it that you really want to achieve through this particular campaign process? Is it behavior change? Is it that you're filling a knowledge gap? Or is it that you're trying to get a policy implemented? And throughout these phases, we are always looking at those, what we call monitoring indicators. So those key factors that, identify if you have achieved what you have set out to do. And throughout, so at every stage, you're monitoring and you're evaluating. So for HCC, we utilize a number of communication channels. We are on social media, so we are on Instagram, Facebook. We're on X, which is formerly known as Twitter, and we're on LinkedIn, because that's where we found our audiences lie. Digitally, we have our website, we have our YouTube, which is another social media application. We have also our Roundup newsletter, and this is sent out weekly through email blasts, to all the persons can go on our website and basically subscribe to become of our members, or just to read or receive the Roundup newsletter. And we would tend to highlight in there, what other NGOs are doing across the region. So identifying, where linkages can be made and strategic partnerships can be made, as well as highlighting what HCC members are doing, across the digital space. And then we usually have our webinars. So we try to do them quarterly. So, identifying a topic that may be popular at the time, topics leading to our campaign launches. And so we would use our webinars then to, give people more information or share with various target audiences what we would like them to do. So our call to actions. And of course, we don't leave out the traditional media space. And I would advise that you still do that, because many people are still, receiving or looking for the news article. They're looking for the op-eds, they're looking for editorials. And for us, it's along the line of food policy. You might see climate change, you see what our youth are doing. And we kind of tie that in again with advertorials, news features, and we're radio spaces, regular programs. And what we would do there, and what I would mention is, we try to insert ourselves in the radio spaces that will not be too costly. So spaces like news, whether it's a news feature, a news program, we insert ourselves there. Whether it's a calling program, we tend to insert ourselves there. And as NGOs, noting, you don't necessarily have the funds that others may have in the working or the professional space. So you have to be creative and try to insert yourselves in spaces that, you know, would not be too costly. And in that, across social media, we try to, you know, boost content. And so whether it's campaign related or otherwise, once we find that there's some relevance and there's a gap that can be filled. And this boost, it would tend, it's in the form of an ad, more or less, that you would see pop up on Facebook or Instagram. And it usually, you can spend about $10 minimum sometimes and reach even wider audiences. And that's something that we always advocate for, because you want to expand your reach. The way how Facebook algorithms, Meta on a whole, the algorithms work is that sometimes you can actually be relegated into a spam space, or your reach may just be, you know, your small community. You tend to want to get your, you know, your word out more, and that as well would bring with it new followers. So you're engaging with more people, you're engaging with a wider audience, your audience then builds. So the online and offline media space. So what we've found is that in many cases, a lot of the offline kind of material, so the material that you will see in the daily newspapers, that is now being brought into the digital space. So most media houses are online. Most of them are in the social media spaces. However, you know, some of this digital content, it may be restricted because not everybody will be following, you know, particular platforms or particular handles. So what we have been doing is bringing that information, once it's relevant, to our space and amplifying it. So giving persons within our health space the opportunity to, you know, see other materials and see that, you know, the conversation is growing and it's widespread, who is talking about it. So that would mean engaging with other NGOs as well across the social and digital spaces. So we've done, over the years, we've done comics, we've done several webinars, as I said. We've also inserted ourselves into a number of radio and television programs. We've done newsletters, or, you know, connected with persons who have newsletters, weekly newsletters, and share content with them that they could include in their newsletters. So these are things that you can, you know, always think about doing to increase your reach. You know, Danielle mentioned in terms of the social media spaces, and Jill will speak more about this as well when she does her presentation. But for HCC, you know, we've more or less focused on the meta area. So that's Facebook and Instagram. But there's also our Twitter space, our X, and then we have our YouTube. But it's important to know as an NGO, you know, what is required to manage these spaces. So that's, as I said, you don't expand your reach, you know, beyond the point of control, because, you know, you definitely have to keep up in these spaces. So posting sometimes frequently, you know, in order for your followers to see, you know, what you're doing, what you're engaging, or even to engage them. So Facebook, for once, we have more or less been restricted. We restricted ourselves, I would say, to posting once on Facebook, so once per day, because we've recognized, you know, before, a lot of our content was getting lost. So posting constantly on Facebook tends to, how the algorithm works, it pushes you, you know, into an area of spam. And that's what we recognize. That with Jill's guidance, yeah, we started to then post once on Facebook, and that brought us into a different space. On Instagram, we would, you know, tend to do like 3 times a day. So again, it is, you know, understanding the various platforms, because what we have been able to do and what you should do is, you know, do a little bit of research, so a little bit of digging within your platform, and you are able to see, you know, things like your reach. So your reach, when you post reach, who you're reaching, you're able to see your target audience, so the age range of your targets, you know, the number of females versus males that are your followers. So that's the kind of thing that we would use, as well as when your followers are online frequently, or how often they are online, and you know the time frame. So for HCC, we found that between the hours of 6, I would say 6 in the morning and 9, you know, that's when persons are getting ready for work. They may be on their way to work, they may be in public transportation, they may be sometimes driving, but that's when they're checking their social media. So just before work begins. So we tend to post early in the morning, and then again around, say, lunchtime period, because that's again when people are back on their socials, and then at the very last hour, you know, within the workspace time. So between, I would say, 4 and 6, we've been able to post again within that time frame, because you want to always reach your maximum number of persons possible. We also use several hashtags, because as I said, some persons actually use hashtags to find content. So we've, you know, used hashtags that are, you know, they connect with your NGO. So that's what we tend to use again, and looking at the types of content used. So in terms of content, so if you are, say your target audience were more of an elderly community, because you're speaking about NCDs, you tend to look for images that will be in, you know, reflection of that, and use those images, high quality images, and, you know, because you're trying to engage your audience. In some cases, they will speak to emotional appeal, intellectual appeal, because again, we want to engage persons. And, you know, your content should always support your headline, but also your captions. And you should be posting, you can post in stories, you can post on your timeline, repost and retweet. That's another very important thing that we've notified. And in terms of who you're targeting, so if you're targeting policymakers and the media, you're tagging those persons so that they actually see. So for us, we've been doing this for quite a while now. We've been seeing, you know, policymakers actually looking at the content, reposting the content that we've shared, and, you know, sometimes even reaching back out and commenting. So that's what you're looking to achieve. Analyzing your content. So as we will say, and Jill will speak more to this as well, if you're developing a video, persons tend to, more or less, in terms of watching videos online, they're watching like the first 15 seconds and then they're tuned out, they're gone to something else. So you would want to include your most important information upfront, just in case they are, you know, turned off or, you know, turned on to something else, that they get your message clearly upfront. Then in terms of your call to actions. So your call to actions, you know, what you want persons to do should be very, very clear and upfront, whether it's in your caption, whether it's on a headline. You're tagging influencers and champions, you know, persons that you would want to repost your material to reach more persons. And then you're mindful then of your colors, your text, the graphics used. I spoke about the emotional appeal. So depending on who you're trying to target, these are the kinds of things that you would look to include and your reach, and that then engages your reach, your impressions, your follower actions, and so on. So what we found too is the use again of, you know, influencers. And an influencer does not necessarily mean a person who has a huge following online, but a person who may be, you know, popular in the society. So in a case like this, a media manager who's on the late night news every week or every night, depending on your news frequency. You know, use those persons in your graphic content, because then you will find that persons will engage your content more. Social listening. So what we have also been doing, again, we spoke about our media monitoring, but what we also do is capture comments, especially when we're in campaign mode. And we use those comments then to generate content. So in a case like this is one example from one of our team members. So this is from the Trinidad and Tobago NCD Alliance. So right in our comments, this is during one of our very popular campaigns, most recent campaigns, one person said, you know, so right now in Trinidad it's high on crime and the authorities are doing nothing about it. So we need a label for that. So this is one of our recent label campaigns. And what Amber, who is the content creator, she would have created her team, created then a graphic card that spoke to crime. So in that terms, the engagement was extremely high then in Trinidad and Tobago in that space, because obviously it was relatable, you know, it's what it was happening offline, then became part of her digital platform. And of course, and Jill always says, don't only speak about yourself, you know, so include what others are doing, reshare content from like-minded, you know, NGOs, you know, increase your engagement, increase your reach. So you're not only posting, you know, what you are doing, creating cards about what you are doing, but also sharing as well what others are doing in this space. And always, as I always say, use high quality videos, use high quality images, you know, because this would help in terms of the level of engagement that you receive for your materials. For media engagement, this and Francine will speak a lot about this in terms of traditional media. So what we have been doing at ACC is engaging with various media houses. So then we're taking then what's happening in the online space into the offline space. So we have bloggers and DJs as well, because they're part of the media and they're reaching people. And they then will create news articles. You know, we get op-eds coming out, and this is from content that we've been placing in the online space. And lastly, I speak about conflict of interest. So for us, and it depends on what your NGO, the focus of your NGO is all about. So for us, we tend to say, you know, if it's the food and beverage industry, I mean, you're running a campaign that you're speaking about labeling, you're speaking about persons eating healthy. It's NCDs, that's your focus. So, you know, partnering with companies like the food and beverage industry, tobacco industry, and alcohol industry would not do, you know, it wouldn't augur well for your brand. So these are things that you tend to want to keep in mind, because your target audiences may be children, your target audiences may be people living with NCDs, or those displaced from their home. So you don't want to be marketing or seen, because I mean, it's just how you're seen, and being attached to a company that is doing quite the opposite. So it's always, you know, be mindful of that. And that's it. So thank you. And any questions? I know if Daniel is going to do questions now or questions afterwards, but you're open.
Thank you so much, Sheena. Really appreciate. Spot on, as usual. Two things, well, two keywords. Identify, strategize. So identifying your target audience, how best to engage them, how you can even expand your reach. Strategizing, considering your platforms, the partnerships, monitoring, engagement of different influencers, and sharing what others are doing in this space. And thank you, Sheena, for ending on the point of conflict of interest and really considering that when we're exploring our brand and partnerships. Thank you, Sheena. Appreciate. And now we have a good sense of the different platforms, the different channels that Sheena would have mentioned. And so now we're going to delve into how we can strategically use those channels for our various advocacy efforts. And so before I hand it over to Jill, just to remind anyone who would have just joined, welcome. Feel free to introduce yourselves in the chat, and we are going to take questions after Jill and Francine, who follow their presentation. So please feel free to note your questions in the chat. And so Jill, who's a consultant with the Global Health Advocacy Incubator, Jill, handing it over to you.
Thanks, Danielle. I'm going to share my screen. Just give me 1 second. I'm going to put it in presentation mode. Can everybody see?
Yes, we can.
Great. So I'm Sheena. I feel like you said many things that I would say. She kept saying, Jill says this. Sheena and I have worked closely together for a long time. I am with the Global Health Advocacy Incubator. I'm a consultant on digital advocacy. I've been working really closely with a lot of the core team on this call, with Abby and Sheena and Danielle and Doriel and Francine on food policy. So I'm going to talk about impact, because I think it's not just about content. It's about who sees your content, what happens to your content, you know, all of that. So I want to start out and ask people, what do you think digital advocacy is? And you can blurt it out, you can put it in the chat. Just tell me what you think it is. I'm very interested to hear what you all think. Don't be shy. I'll call on somebody. And if you met me before today, you can't answer the question. Anybody? Just one word, maybe? Could type a word in the
I guess I'll do it. Using hi Soldi. I guess using social media to advocate or to raise awareness of a particular issue.
Okay, I like social media and I like advocating. Anybody else got other words? So it looks like there's something in the chat.
Someone said transformation.
Transformation, that's definitely part of it. Change, right? Anybody else? Using social media and digital platforms as a means of advocacy, education, and awareness. Okay, yeah, you're on to something there. Anybody else? I'm looking for one more. Don't be shy. If we were in the room, I'd look at you and stare you down. Technological impact. Well, it's using technology, that's for sure. And I think that's something that's come up. Anybody else? All right. I'm going to give you my definition because, oh, there's another one. Using social media avenues to communicate with the masses. Well, you're definitely communicating, and social media is definitely part of it. So what we've got here is engagement. Marilyn says that's also good because I think that that's an important part of it. Digital advocacy is the use of online and mobile tools to engage a target audience, inspire them to take action, and wield power to achieve a specific policy goal. So I think the thing about this is that it's pretty targeted in terms of what you want to do. You have a specific audience, like Sheena talked a little bit about, the action part of it, which I think some people mentioned a little bit in some of the comments, and then that power part to achieve the goal, right? And also having a clear goal, a policy goal. Advocacy is about policy. And I think that that's a really important thing to remember. I don't know if there are any thoughts or feedback or reflections on that definition. I like to start out because I think a lot of people have different ideas and thoughts, and everyone comes from a different context, and sometimes it can be different, but this is the one that I'm working off of today. Any thoughts? Okay, great. I'm going to keep going then. So I really want to talk about driving from awareness to action. So I think what's really important in advocacy, I think sometimes we like to complicate stuff because we're so busy changing the world and we know what the world needs, right? At the end of the day, there's really basic stuff that this is about. I always say that you don't just meet someone and ask them to do something, right? You have to talk to them a little bit and maybe you find some common ground before you ask them to do something. And I think that edict of life applies to advocacy as well. So we really have to start by building awareness with people. And that's really on this left-hand side, which is that building that public awareness, increasing the understanding among the general public of core issues, facts, the importance of the topic. And this is really that marketing part of it. This is, we don't know what's in our food. This is drink more water. This is all of those kinds of things where you're really making people aware of something that maybe they didn't notice. I mean, what's in our food? People maybe hadn't thought about, wow, I don't really know what's in that food, right? But then in order to make change, you have to also define a problem because sometimes people don't see problems either, right? And so this is where you're going to kind of create not just a problem, but also urgency, because at the end of the day, if it's not urgent, people are not going to do it. I don't know how long your to-do list is, but like mine is pretty long. And at the end of the day, if I don't think something needs to be addressed now, like now, I'm probably not going to do anything, right? And so I think that that's a really, really important component of this work that we're doing. This is content that's demonstrating need for systematic action, change to address a pressing public health crisis. So childhood obesity, NCDs have become a crisis in our country. People need clear front of package warning labels to know what kinds of foods to avoid. And I think what's important here is defining the problem, connecting it to, where you are, and the fact that something needs to be done, a solution is part of that, right? And this is sort of where you start to go from marketing to advocacy. And then you kind of get to this 10, you see it's red, it's red, it's red. This is advocacy. This is that demonstrating support or pressure for specific policy action to serve this urgent issue crisis, right? This is the petitions. This is the demonstrations, if that's the vibe where you live. It might or might not be. Everybody has different things, right? But the whole thing is that a decision maker sees that a group of people is very concerned about something. That is advocacy. Now, what I want to say about this is that I know this looks like a lovely little straight line, but I've been doing this for a long time. I got gray hair, you can see from doing this. And what I would say is that at the end of the day, advocacy is never a straight line. And sometimes you're going to be all of a sudden at a 1 and you have to jump to a 10. Or and sometimes that's because of someone else is doing, all of a sudden someone who's important says that something needs to happen, right? Or sometimes you could be sitting and stuck at a 5 for entirely too long and you're like, I need to pump this up. I need something to happen. I need some change. I think sometimes inaction is a form of action, right? And sometimes you need to light the fire under people. And so sometimes you're driving it to 10 because you need something to happen. And so you're not always in control. It's not always a perfect line, but I think that this is a really good framework to help you think about how to do advocacy and the important building blocks in terms of the outputs that you're creating to do it. So I am gonna, are there questions about this, comments, feedback?
Jill, I think this is a really good framework, as you mentioned. I hadn't thought of it like that, and I love how the what you said about sort of getting to know the audience first before asking something of them, and so sort of doing this strategically. So yeah, I think something that we could probably all use.
I know, because I think sometimes we're guilty of thinking that everybody knows what we know because you all are so immersed in what you do, but they're not, they don't know. They're not reading the same things as you. They're not paying attention to the same things as you. Think about your sister who is the opposite. My sister is the total opposite of me. When I talk to my sister about when I do her eyeballs glaze over, she could care less. Right. And so if I was going to try to ask my sister to do something when it came to advocacy, I would have to start at 1, even though she's someone that I know. And so I think that's what's really important. Just a lot of times you really have to start at the beginning. Even though I know that you all have been sitting at the beginning for an eternity and you were tired at the beginning, but you know what? You got to keep, that's where you got to start. Anybody else? All right. I'm going to give you some examples of some cool advocacy things that have happened all over the place, including in the Caribbean and Barbados, which is the first one on the left. As you can see, in 2021 on World Health Day, the wonderful youth advocates that work really closely, that were at that time working really closely with HSFB, they got together to do an advocacy action, and they really focused on Instagram because Instagram is very popular for them. And what they did was they all wore shirts, you see, we deserve better, and they all took their pictures and they tagged all the decision makers involved in the school nutrition policy. Because at that point, the policy was not, it was a little stalled. It was, you know, it had been progressing. It wasn't like they weren't starting at the beginning, but they were kind of stuck in that 5, 6, right? Francine? I feel like Francine should probably explain this rather than
No,
me.
absolutely. Go ahead, Jill. You know it well, but absolutely. Stuck is a good word.
It was a little stuck, and that was what motivated this action, was a little stuck. And so they did this activity. They posted on Instagram. There were probably, I don't know, 25 of them who did it. And what I'd also say is that this was really great, and it was an online action, and Minister Humphrey responded, as you can see here, that they're working on it. But the other thing is that this didn't also happen in isolation. And I think Sheena talked a little bit about this too. It's that they also had champions who were doing Instagram lives. They had earned media happening at the same time. So there were a number of activities all happening, and it kind of creates this moment, right? This moment, and that moment kind of, sometimes it's like a little, sometimes it can feel like a nudge, or sometimes it can feel like a kick to the people that you're directing it towards. But I think that in this case, it was the right kind of nudge, and it did help to kind of reinvigorate the conversations that had been going on. And I think that's a really important way to think about advocacy sometimes, is that, and that was, I think, a great example of the Heart Foundation of Barbados putting themselves into the driver's seat and saying, hey, we need to do something. We need to, you know, and they took a day, World Health Day, which is, you know, a great, I mean, these days are a wonderful opportunity for you to to make something happen. And that's exactly what they did. And I think they really capitalized on it, you know, with digital really driving the way, youth advocates really driving the way, but other communications efforts being complementary to that to really help. I think what it does, those, when you add all those things on, it takes it from like a six, like from a volume point of view, right? You're turning it up, you're making it louder. And I think that's what really had the impact. Francie, I don't know if you have anything else to add.
No, Jill, I think the key is also, I mean, making the point that with the support of persons like yourself and expertise, what was good, I think, was that we were able to not just do something on Instagram, but have a very strategic plan as to how it was done. And I think we had drawn on a very specific influencer to drive the initial conversation and that kind of thing. So I think it's the point is not just using the social media, which I think is what, but using it strategically based on where you are in that three-pronged or pillar process that you spoke about. So we do use the Instagram and we put out posts and so forth, but this was a specific day, which I think we had reached that place of pushing that something very strategic was needed. And I think that was this particular one.
Yeah, thanks, Francine. And then in the middle, this is another really good example. This is a decision maker came to an event, and this is a while ago in the UK, at the Obesity Health Alliance. They had an event and about the sugary drinks tax in the UK. And here they have a decision maker who they've tagged, holding up a sign that says, I will work with the Obesity Health Alliance to tackle childhood obesity. And the cool thing about that is that it shows, it highlights a champion, right? It gives the issue visibility with someone who's prominent. He's a member of parliament. People know who he is. The third thing is it also leaves him a little bit on the hook by publicly declaring and showing that he's supporting this. So you can go back to him and say, hey, you said you were going to do this. What's going on? So I think that's another really good and interesting example of digital advocacy. On the right-hand side is another example, I think, of digital advocacy, which is in Argentina, where they last year, or 2 years ago now, passed a really strong food labeling law. And they really struggled with their law. It's one of the most comprehensive in the world, actually. And they struggled because, of course, the food and beverage industry was heavily interfering in the process, and it was moving along in the Congress, and it was kind of stuck. And it was Children's Day in Argentina. There were very strong provisions in the bill related to restrictions on marketing to children. And so they took that day and they created an opportunity out of it because they were trying to really kind of get this thing to the finish line. And what we came up with, we worked together with them, and they came up with on a Sunday, and I lived in Buenos Aires, and that's where they were. On Sunday, everybody sleeps and takes a walk in the afternoon. That's what people do, and with their families. And so what they did was on Sunday, they went out and they put all these stuffed animals in front of the Congress with, you can see they have signs that say clear labels now. That was their hashtag. And then pictures of it. And what they did was they came out and they did this. And of course, it got not just lots of attention on social media, it also got media attention. They were out talking to people about the law. And this was a really great way to drive attention. And then people who saw this were taking pictures and using the hashtag. And so this was a great way to sort of drive that attention, and doing it in front of the Congress also helped to sort of make the point that the decision makers needed to be doing something. And this was a really, I think, an important moment for them in terms of pushing this legislation forward that eventually passed. And these are lots of different ways to do it. And I think what's really important about all of these is that they have an offline element to them that's living online as well. So I've got more, because I think it's really important to understand, because I also know that every flavor is different. Every country is different. Every context is different. And, the way that they're doing it in Argentina, it might not be the way you do it in the Caribbean. Heck, the way you do it in Trinidad might not be the way you do it in Barbados. I know enough to know that. So here's some other really cool examples. On the left-hand side, this was a lobby day this is from the US. This is related to tobacco, and they have all these young people went to go see the decision makers, and they tagged all the groups. They had to put photos out. They had a hashtag. That's another really good example. Here's another one from this is youth on talking about why they are involved with tobacco, and they're Gen Z tobacco free. They did a whole thing for International Youth Day. They tagged all the decision makers, and this is the youth talking about, what my superpower is. That's another really, really good example. It happened all around the world. The one here on the right is from Senegal. This is also a tobacco example. And they met with a minister, and they took a picture and they tagged him and tagged everybody. That's another really, really good way of, again, showing that offline activity living online. So I don't know if there are any questions or comments about some of these digital advocacy examples, or if people want to share their own examples of doing digital advocacy. I'm always looking for good ideas, so please, I love to steal from people. It's my favorite thing to do. Anyone? You got nothing for me to steal?
Hi, Jill. Mishran here.
Hi, Mishran.
Yes, I know most of the platforms used are Twitter and Instagram for advocacy efforts, but I just wanted to know, what are your thoughts of using WhatsApp as a digital advocacy tool as well, and possibly the effectiveness of that?
So I think it's funny that you mentioned this, Mishran, because I literally, for the last 2 weeks, have been reading about all the functionalities of WhatsApp and trying to translate it into how you could use it for advocacy. I think that what is like a little bit challenging is that you have to, I think it's probably going to be hard to initially drive people there. But I think if you already have a relationship with people, because that's a separate thing that's probably going to cost money and take a lot of time. But I think if you already have groups of advocates engaging on WhatsApp, that I think it's really easy to, take a social media post and slap it into a WhatsApp chat, or creating groups of people who live in a specific area, so they can plot and plan. The one thing I'd also say about WhatsApp, though, is that if you're engaging, if you have a group of people engaging in a free conversation, you're going to have to spend a lot of time moderating that and keeping an eye on it and making sure it stays focused and on topic, which sometimes can be really hard. That's my experience with WhatsApp. And then if you're doing that, so the other option, if you don't have the time to do that, is that sort of broadcast message type. And I think the challenge with that is that it's going to be very action orientated. But maybe people, because they're not engaging with it, I don't know if it, drives the immediacy that a typical WhatsApp message does. Because I think the value of WhatsApp is the immediacy of it. It's like faster than an inbox, right? Who here spends, like, my number one app is WhatsApp. I live on WhatsApp. I live on it for work. I live on it for my life. I just live on that thing. And so I think that, that is the value of that space. But how you use it, you have to think really carefully about who you're talking to and what you want to get out of it. So I hope that helps.
Yeah, for sure. My reason for asking, I know WhatsApp recently introduced WhatsApp channels, similar to how you would have Instagram and Facebook stories. But for World Obesity earlier this year on March 4th, we actually had a WhatsApp takeover where we asked the advocates to, change their profile photos to a generic obesity related photo, and then to also share some information regarding World Obesity Day in their WhatsApp stories. So it was from that angle, and possibly improving on a WhatsApp takeover, but for another time, more strategically, if anything. So that's why I was asking.
Yeah.
And then obviously,
go ahead. Sorry.
one of the important things for digital advocacy is engaging policymakers. So it was, finding a way to engage those policymakers via WhatsApp, and not just sending out information for the sake of
Yeah, and I guess it would be, are they following you on WhatsApp? Are they paying attention to you on WhatsApp? And I think that's the critical thing. So if the decision makers are not in, and I'm gonna get into this, actually, I'm gonna get into this. So, so I think that, you know, in terms of an awareness building tool, in the manner that you're using it, yes. In terms of drive action, I think you have to be much more specific and probably already have a relationship with people. But is it an awareness tool? Sure. You know, all of the communications channels are awareness tools. But in terms of actually driving digital advocacy, again, you'll need the relationship with people. But I'm going to talk a little bit more about who is your audience and platforms. And Sheena talked a little bit about it too, but let me talk about it this way. So the first thing is a primary audience. So these are the people that you want to directly impact and are critical in the achievement of your policy objectives. These are usually the decision makers, the technocrats. These are the people who are like, yes, let me sign on the dotted line. And sometimes it's one person, sometimes it's 2 or 3 people. But don't be confused, because there are other kinds of people who are very important, but who aren't these people. But if you are not the yes person, then you are not this person. What you might be, though, is the secondary audience, and they're very, very important. So these are individuals and groups that have the potential to influence the primary audience. They can be opinion leaders, they can be journalists, the media, special interest groups, or those that can influence that the primary audience, spurring them to take action. At the end of the day, the general public is too broad of a target audience. And look, I know that a lot of you come from places that aren't humongous. You know, we're not talking about millions of people. Sometimes we're talking about hundreds of thousands. But at the end of the day, we do not have enough money, time, staff, wherewithal, ability to persuade, to be able to reach everyone. And so you have to really define that target audience. And what I would say it's really important in your target audience is that you have to think about who influences that primary audience. But also then I think that you can also think about who is likely to engage with this that can then go to that primary audience. And those are the really important things to think about. So who is important to the primary audience? Who can get to them? And I think, you know, look, people who are prominent in communities can do that. People who, I mean, sometimes it can be really wacky things, you know, like it can be that, you know, someone's kids go to the same school as a decision maker. I mean, all of these things are ways of influencing them. The media is always going to influence them, because at the end of the day, they, as Sheena was saying, you know, they read the newspapers, they listen to the radio, they watch the TV, or the people that work with them do, who are there to filter that out for them. And this is what's really, really important when you're thinking about what you're doing, because at the end of the day, you are trying to get a decision made. And just talking to the hills, I always call it spray and pray. I'm going to just spread it everywhere and hope that it gets somewhere. Well, you know what? That is not a strategy. And I really encourage you to think about who that primary audience is and who that secondary audience is. Where does your audience live? So this is a little bit to the point that Mishwan was making, and I think Sheena also alluded to it. At the end of the day, if your audience is not paying attention on the channel, then you're not talking to them. So decision makers, to Mishwan's point about decision makers on WhatsApp, that might not be the best play unless they're following them. You know, another example is in Barbados, they found that decision makers are really responsive on Instagram. In other contexts, it might be that they're really responsive on X. I think that, you know, TikTok, I know everyone loves TikTok. I have a lot of questions about TikTok. Are the decision makers on TikTok? And if they're not, is the information from TikTok getting to them in some way? It's a question. I don't know the answer. And again, it will depend all on your context. I know everybody wants to use every channel, but at the end of the day, the people you have to think about who you're trying to reach and where they are living. Because it might make more sense to not be on every channel and focus yourself on 2. Because unless there are 10 of you, you're not going to be able to focus on all of them. And I think that's a really important part of the work that you're doing. So what I would say is that think about who you're trying to talk to and if they're living on the channel. So if you wanted to, just as I'm thinking about that WhatsApp example, if you wanted to build awareness, again, starting at that level 1, WhatsApp might be a good place to do it if you're trying to, if you're a public health person and you know lots of public health people. But if you're trying to reach decision makers, I think you got to go where they're already living. And that's what's really, really important. So I want to talk briefly because I don't have a lot of time left and I'm going to get in trouble if I go over. So how do you break through? There's a couple of things. And I think Sheena also talked a little bit about them. The first one is be relevant, because again, people are barraged with information. If it is not relevant to me, I'm moving on. You know what I always say? It's like, my husband loves sports. I do not love sports. I'm okay with baseball, but I don't really like them. But if I watch the commercials that are on during the sports, they are definitely not talking to me. It is not relevant to me. I don't watch sports. That's the first thing to think about. Be timely. At the end of the day, we live in this world of immediacy, right? Everybody wants it now. What's happening now? There's helicopters. What's it about? I'm thinking about Sheena with her helicopters today. And then be clear on what you want them to do. Don't mess around. If you want someone to do something, just tell them, or else they're not going to do what you want. So I'm going to briefly talk about content for impact. It's all about the message at the end of the day. All about it. Urgency. Active voice, no passive voice. Tell people what you want. Don't beat around the bush. I know there's a lot of cultural differences. I'm from New York. I'm super aggressive. Sometimes that doesn't work. It doesn't mean you don't have to be like me, but you can use an active voice. Strong and clear call to action. Again, I can't emphasize it enough. What do you want from people? Just tell them. And then use your unique voice. Everyone who's here is working for a CSO or an NGO. Some of you have initials in front of your name or after your name. All of those things are really, really important and really, really valuable. There's a whole story of how you got here. That is what makes compelling content. You have stories to tell. You have expertise to share. And think about all of those things when you're creating your content and what you're talking about. It's really, really, really important. So I know that everybody loves Canva. I love Canva too. Canva has incredible resources in Canva about how to use it and all of that kind of thing. I want to give you my 4 tips. So what I would say is allow the image to lead and the words to support the image. Remember that all of these platforms now more and more are visual. They're driven by the visual. But if you just have words, that's not enough. A compelling picture with a few words can really drive things. And I think that's what's important. Colors evoke emotions. Think about this when you are also considering what you want to convey. Blue, cool, calm. Red, hot, hot, hurry, hurry. So don't be afraid to try different fonts, but limit it to 2 different fonts. As you can see, I used a gazillion different fonts here. It looks kind of crazy. And then don't worry if you're not super creative. I understand not everybody has that. Canva's templates are incredible, and I really encourage you to look at those, ideate off those, and they're there as a resource. I cannot speak enough about the templates. The other thing I'd say with Canva is that if you are a CSO, they have free, you can have Canva Pro for free in most countries. And that's really worth looking at because the Pro obviously will amp up your game. And that's all I have. I think there was something in the chat. Policymakers also need to understand it's not about them, but about our population and not take campaigns as a personal attack. Yes, I think that that's really, really, really important. But what I also think is that there's a carrot approach and a stick approach. And I think that you have to decide what works in your context. But also at the end of the day, they're going to do what they want to do. They are all about holding on to their power and getting reelected. So you have to think about framing what you're doing in that kind of context. So I hope that helps. I'm over time. I'm going to get in trouble. I already see Danielle.
Oh, Jill, that was amazing. Thank you so much as always, and such a good build on from Sheena's presentation. So again, I'm hearing, and I'd love to hear everyone else, your key things that you're taking away from each presentation. But again, I'm hearing kind of the same themes as Sheena, but building on them, identifying and strategizing. Jill, one thing that we spoke about, Sheena mentioned about the importance of defining your target audience. And it's something that we spoke about 2 weeks ago when we were discussing brand identity and how important it is to really, from the outset, figure out who you're trying to engage in your work. But one thing that you mentioned, Jill, is not only defining your target audience, but who influences them and how key that is for our advocacy efforts. strategizing, thinking about where these people live and really being intentional with the platforms that we choose, especially Jill, as you mentioned, a lot of our CSOs, NGOs in the region, we don't have a lot of resources, especially to dedicate to content creation, social media, digital advocacy. So really being intentional there. And you gave lots of tips. I won't take up too much more time, but lots of tips for creating content for impact. And again, something that came up that you brought up that we addressed 2 weeks ago is the importance of storytelling and our unique voice and how that can shape our brand identities and also shape our messaging. So thank you so much, Jill. And again, everyone, please pop your questions in the chat. We are going to head into our Q&A session after Francine. So it is my pleasure now, again, we're building, to invite Francine Charles. She is the program manager for the Childhood Obesity Prevention Program at the Heart and Stroke Foundation of Barbados. And Francine is going to talk to us about developing relationships with the media, and she has years and years of experience that she's going to share. And she's coming from a unique place, having worked with the media, but then also, as a lot of us are, in the CSO NGO space. And so Francine, we're excited to hear lessons learned from you. Turning it over to you.
Thank you so much, Danny. Really good presentations so far. So there's clearly a build-up, and Sheena has dealt very well, and Jill with the social media side of things. Social media is still a part of the overall media when we talk about engaging, but I imagine for most of us in the region, the traditional media, meaning all of those groups that allow us opportunity from mass communication to talk to the public, still redounds within print, newspaper houses, television houses, as well as the areas of like magazines and that kind of thing. And also, of course, our pervasive one, which is radio. So we're going to kind of focus on that today when we're talking about engagement with the media. Really good to be here. I sent out a selfie just a while to some people saying, not the usual Saturday, but really, really happy to be here. So just to share a little bit quickly so that you would know who we are. My team, as Daniel mentioned, I come from a media background, have worked both behind this as a media person, as a journalist, but as a broadcaster, but has also worked in the PR space, and now with the advocacy space. So just a little full disclosure there. Our team is part of what we call the Childhood Obesity Prevention Program, and we are the advocacy arm at the Heart and Stroke Foundation, focused on calling for the implementation, specifically at this point, of World Health Organization evidence-based policies. And at this point, we have been advocating for at least a 20% SSB tax, which we were happy to see in 2022, I think it was implemented. School nutrition policy, which has been implemented, was implemented in April 2023, sorry. And we are still working on settling down that policy. Front of package warning labels, which, as you know, has been a real struggle at the regional level. And so we're still pushing there. And then the one that we're looking forward to beginning some serious work on is a ban on direct marketing to children, starting particularly in the schools. And our program is supported by the Global Health Advocacy Incubator, which Jill is a part of, and Vital Strategies. And it's not just funding, but it has been a lot of technical and best practice support, which has been invaluable for our work. Apart from the Heart and Stroke Foundation, we have been able to pull together real support from civil society organizations, whether they're in the health space or non-health space, to be part of what we call the Childhood Obesity Prevention Coalition. And right now we have about 30 civil society organizations, as well as individuals who are passionate about the issues, and a full youth advocacy team, of which Mishran is really the lead on that. And so all together, we have been really working to advocate for childhood obesity prevention policies. And it has been tremendous experience. And of course, a major part of it has been building the engagement with the media. And so as we know, media, which are really in most of our Caribbean territories, I think I saw someone from Ghana on the link as well. A lot of it really redounds to journalists, reporters, presenters of maybe morning shows. That kind of spectrum is our world of media. And they represent a significant bridge between our organizations, our CSOs, and the wider public, especially with funding. And in all of our cases, funding is an issue. So in a way, it allows us that earned or free space to be able to communicate with the public. Yes, we could pay for ads, etc., but on a daily basis, it really is the free access to the public. And the media's lack of information about or disinterest in our issues, I'm sure all of you all would understand that, especially if you're in health, can result in a huge barrier in your communication strategy. If they're not interested in your topic or they don't really know about it, and in most cases it's because they may not have the information, they will not drive your stories. They may not even attend media conferences that you have and may put it on the back burner. But if the media's interest in or awareness of your organization's issue is fairly high, it can really redound to what we call significant earned media, which is where they write stories, they engage with us, and therefore they invite us on programs, and therefore there's a lot going out about our topics. So that's really key for all of us. I will say 3 things the media love. They love when you or your organization is accessible. Some organizations come across as very inaccessible, and it may not even be in whether or not they entertain interviews or they entertain the calls from the media, but even how you language your organization. Some organizations come across either very highbrow, and it can happen in health, where the issues sound so far or high above kind of everyday simple languaging that your organization seems inaccessible. There's also the issue where your organization may be afraid of the media, and therefore your capacity or interest in engaging can be quite low unless you wish to say something, and we'll come to that. We love when you acknowledge the value of the media via capacity development opportunities. So you have a workshop or you have some, maybe a little breakfast where the journalists can come and sit and understand the issues, or you do some training, invest in some training for them, whatever the areas, but you acknowledge that this is a valuable part of our process. And then when you provide material or content that assist them with the stories, that's a big thing, right? So that they don't have to do as much of the research, and I'll share why in a little while. 3 things the media hate: your availability only when it benefits you. So you have a press conference or you have something to say. Outside of that, you're not accessible to them. You're not going, that's, if you want to not build relationship, that's where you start. And that's kind of general for any relationship, right? Using built relationships to push a non-story. So you have a journalist or journalists who are engaged in your issues, but you have a non-story. The thing doesn't have any context or news value. It's really a PR piece. And you are trying to use that relationship to push that. You have to be very careful in that area. And then blurring the lines between your business arrangements with their media houses and the news. So for example, your media house and maybe placing ads for every health day, or you place ads for a campaign. And because of that, you figure they should cover your stories. There's actually a media house is actually separated in most cases between the news process, which is a process of a particular process, and the business that is done to keep the media house going. And so you have to be careful. It's not that they can then trample all over your story, even if you may be investing in them, but you have to be careful about how you blur those lines and your expectations of journalists. Those things turn media off. So civil society in particular, we have a particular perspective. Business community has a different perspective. entertainers and so forth have a different perspective on what they need to do in terms of building effective relationships. So I'm kind of honing in on what we need to do, or that we can do to build some effective relationships. One, we need to identify and invest in reporters or journalists that have an interest in your area of work. And this can be where there's a very specific focus. We've had situations where there are journalists who have been unwell, or they've had family who have suffered from diabetes, etc. And they're very interested in this particular topic. And so you find that they will always, if you have an event or they'll call, they're trying to pull out information. They want to talk about the topic beyond the press conference. Pick up on that. That's important. That's a relationship that can be cultivated. But then there's also general interest. There are journalists who just would love to be covering things that are more human interest, or covering things that are more justice focused. They may not be specifically into your area, but they have that leaning. If you pick up on that, either through their stories in the papers, or when they come to an event and you meet with them, spend some time and invest in that relationship. Meet the journalists at their need where possible. So for example, some journalists, they're busy, they're running from one story to the next. They need content and materials. So sometimes, why not package some of the information that you've received in your area and send it to them so that they have something to build a story on? Do they need one-on-one time to better understand the issues, especially in areas that may be intricate? You may want to take that journalist aside for a while, even after an event, and just spend some time talking with them. Don't be thinking, oh, I have to go do this. Spend some time and invest in that relationship, and maybe explain, for example, how does, a body mass index work? There are things that they don't know. Don't make them feel that, oh, you should be knowing this. No, they're journalists that may not have this training, and they've come to your event, and they've asked the question. Don't think in your mind, oh, but how come you don't know BMI? Spend some time and explain it and build that relationship. Then create opportunities for capacity development, whether it is a journalism workshop or a technical workshop. So the journalism workshop is where you actually invest and train them as journalists. You have journalists come in, senior journalists, and do a training with them on how to cover a health story. And then there's technical workshops where we are having a workshop. You're having a workshop on conflict of interest, or you're having a workshop on the issue of diabetes prevalence in your country. A specific journalist, do you want to sit in and learn more? And those things would be very helpful. There's a webinar on obesity prevention policies that the World Health Organization is doing, and we are invited to it. You can find out if you could invite a journalist, especially if it's a webinar, they can attend, and invite them and say, look, we have this. If you have the time, you want to hop on and learn more. And then give your journalists, those are the journalists that you're starting to cultivate that relationship with, give them the extra edge every now and again, right? Because it's also a professional thing. So give them that one-on-one interview. If you have a special interview, one of your youth advocates just went to Russia as part of a special team to deal with NCD prevention in a global scale, and they come back. You can call and say, listen, I have a story for you. Want to interview my youth advocate? That's a great story, and they get a little extra. It builds their professional persona as well. And nothing they love more if you would say, yeah, here's my phone number. You can give me a call if you need to know more about a story or you're not understanding. Give me a call. That direct contact is huge. They will use it. Some breaking news, I say, because I'm part of this space and I hear people talk all the time. It is key to understand the current media environment. The BBC days are over. Journalism has to fit into a very entertainment and commercial-driven environment. So your journalists are not able to spend as much time before on stories that may seem all about the nation and all the great ethereal things. Sometimes they are on the job, you know what I mean? And a lot of stuff has to appear more sexy. So we need to fit in there. Most newsrooms are under-resourced in the Caribbean in a true way, and most journalists are required to be jack of all trades and master of none. So if you can help them and support them with materials for your area, you will have an edge. Just crafting effective press releases. The time is running faster than I thought. So now more than ever, organizations have the opportunity. Before, in my day, I couldn't use a press release as a story. I had to write my own story. Now we can use press releases. So it allows organizations like ours to be able to tell our stories via effective releases. However, the media release must be effective. It must be helpful to the media house. So your press release should be primarily a news story and not a public relations item, right? It's written in a way that seems not that it seems objective, but that it doesn't seek to push your agenda in a very blatant way. It should be written according to the news reporting pyramid structure, and it should provide strong quotes from headliners. It should not be long. A lot of us like to write these long things. A 1 or 1.5 page press release works because your aim is that your press release does not have to be re-edited, because that's where you lose, is when they start to re-edit your stories and no longer tell it in the way that was intended. So this was just a sense of how journalists write stories. So as a reporter, this is what you would learn, that this is the pyramid structure. An effective lead grabs your attention. So if you are going to have an obesity conference, don't just start and say, our organization will be having a nice, they'll be having a wonderful conference next week. No, say something like, you start with, obesity has become a major challenge in the Caribbean or in our country, costing us millions of dollars. Boom. Then you go into the body of the report and talk about that this will be the area of discussion context of an obesity conference that your organization is hosting. And you, inside of there, get some quotes. Maybe the president of your organization can say, yes, it's time for us to do something. If not, we are going to lose more and more of our children, as we have seen over the last year. And then in the end, now you close off with maybe a statement about what is obesity, something that adds to the information. The strongest leads are the ones that contain significant statistics and data that speak to a dollar figure that includes a headliner making a strong statement. The head of the organization is usually a strong headliner. So when you because once you say the president of the Heart and Stroke Foundation, they will use that. But if you realize that they're not using it because probably your president is not the strongest person in your organization, it may be the advocacy officer or somebody else who's really out there and everybody knows them and they've been high profile, then you use that person as your quotation. And then at the end of your press release, always include a contact in the event that the reporter has any queries or would like to expand your story further by doing a radio interview or inviting you to do a TV interview. And then, of course, if you can, and you're sending the press release, try to send a photo of either the event, a good photo, or a photo of the person who has done the quote. So you have really created a full report for them that they can easily use and get your story in. Just some stuff here to show you some of the earned media that we have been able to achieve over time. So what happens here, because we've built some relationship, if there's a major issue, like when the SSB tax was being implemented, the media didn't go out on their own and try to find people. They actually called us and said, can we get some significant interviews and responses to what the industry is saying about the tax? So we were able to choose our strong headliners to do the interviews for them. And so that's the beauty and the benefit of building that relationship far in advance. Here we were able to write our article. This is where we were trying to call for lower taxes on healthy food imports. And we were able to write the article ourselves, but it was sent to the media and they used it as is with no issues, no cost or anything. And that's because of the relationship that we are building and engaging them, not just a personal, but they now understand the issues and why the issues are important. And so very important here now is just the value and the importance of us understanding the different media. So if you are working on print, and that's the engagement that you want to get, your stories in the papers or whatever, you have to know that the stories here can be a little longer. The writing style can be more descriptive. And the value for us is that it gives us the opportunity to amplify and explain our message, especially at a more academic level, if that's the need. So you want to explain more about why obesity prevention is important and why the NCD crisis is significant and what is the data showing. Or it allows you to do a compelling storytelling. So if there's somebody who has suffered with diabetes that wants to tell their story to help push this policy forward, that's the medium for you. The radio now needs to be short. You cannot send them long pieces. You need to send short pieces. Your language needs to be simple because people are hearing it on the live. They don't have a chance to go back and read. What did they really say? So you need to make sure that your language is simple and try to be descriptive. Value of radio is that it's an excellent vehicle for CSOs for interviews. Try to get interviews, especially if it's free. Try to get yourself onto interviews and speak directly to the audience yourself. So it's your messaging, unfiltered, directly, allowing you to use your more effective presenters, your style and your tone. What we do is that we make radio work for us. When we get opportunity to do an interview, we also create a poster or flyer on social media using very sassy pictures and, not dowdy and making us look as if, it's health, but making us look like we are in the do and in the know. And we post these so that it attracts audience attention for the radio interviews. And then when it comes to television, your stories need to be short, again, language simple, but this time use of video, good video that you could send them to look, can you cover this story? And the value for us is that this allows you full impact. I'm almost finished, full impact, drawing on language, visuals, and personality to influence the viewer. The problem with TV is that TV can work against you if you don't have the best combination of that. And just to end, I wanted to end a little light to show you why TV is no light matter. TV is so important in terms of what you look like in that presentation or what your video looks like. So it's not just about your content, it is about the person, the personality, or the presentation of your organization. And thank you very much. This is just an idea of what not to wear, guys.
All about branding. Thank you so much, Francine. Excellent as usual, incredible and invaluable insights. I know I already saw in the chats, a lot of people are taking away these gems, and Miriam, who is part of the media team at a cancer hospital, says she feels validated with a lot of what you were sharing. Just some things from me. Francine, thank you for emphasizing the need to take time to know our journalists and not only telling us why we need to doing it, but also showing what that result was for HSFB in terms of the incredible earned media. You're getting VIP kind of access to the media, having built those relationships, them actually reaching out to you. So it's worth it. It's worth taking the time to really build those relationships, giving them support, especially given the kind of work that we do, at least in the health space. I know we have CSOs joining from different spaces and really making health. I know we've had this conversation time and time again, but making it sexy and helping the media to kind of understand that angle. So again, folks, thank you so much, Francine. Feel free to jot down any of your thoughts as well, your key takeaways. And what I'm going to do is invite Sheena and Jill to join Francine, as we'll have a quick Q&A session before hopping into the second part of our session today. So I haven't seen any questions in the chat, but do we have any questions? Feel free to open your mic and ask any of our three speakers. Or even if you have any stories to tell or any key takeaways, anything that resonated with you, we'd love to hear.
I have a question. So we're sort of talking about how important social media and media in general is to CSOs. But for those CSOs that are tiny and operating, it's, you know, close to being a one-man show. In terms of the time investment for social media in particular, what would you suggest, I guess, or some tidbits?
I can start. So, well, first and foremost, you know, sometimes scheduling content could actually work. For me, generally, I used to schedule a lot before, but then because as Jill mentioned it, it's such a fast pace, Francine too, it's such a fast pace, like, you know, everything's happening so quickly, especially in the Caribbean, that you may have a post schedule about obesity, but then, you know, something happens on that day and, you know, the topic of, you know, all over the media, you know, in every space might be about cancer. So then your post then, you know, is posted and is speaking directly about obesity, when really and truly, maybe it should have been targeted or more tailored towards, you know, some form of cancer. What is, you know, how do you prevent, you know, what do you eat, not eat, you know? So sometimes scheduling could work, but you have to be mindful and maybe you would have to check in, you know, and checking in too. Again, you may not have the time to do so, but checking in to ensure that, you know, your content that's posted is relevant to what's happening at the time or on the day. Because it could also be something tragic that happens that you could probably or should speak to as an NGO. It may fall into your purview, and you may have to change up or switch up the content that you had intended to post. So that could help. But other than that, what I found, as I mentioned, is sticking to those times. So identifying from your platform, your social media platform, you know, the times that most of your followers are online. So if that's in morning, you know, in the morning between 6 and 7, perhaps you post at that time. So then it helps a lot in terms of your own time management as well. So you're not always, you know, you're not constantly on socials, but you know, you've identified maybe 3 or 4 times of a day that you can post. And using that, I find it helps tremendously.
Thank you for that. Yes.
And Marilyn, go right ahead.
Good morning. All presentations so far have been truly brilliant and full of practical, profound, far-reaching comments.
Did we lose Marilyn?
I think so. The
And
audio- hello, sorry.
Hi, Marilyn.
Hello.
I think we lost the start of your question. Would you mind repeating, please?
Okay, I was thanking the presenters. Can you hear me better now?
I can hear you well.
Yes, I was just thanking the presenters, but I wanted to make a comment and a question from the comment, if I may.
Of course.
Okay, the comment is when one steps back from the issues that the very key issues that we're targeting, mostly we were speaking about chronic non-communicable diseases, for example, and different aspects of that. When you step back and you look at the impact, I mean, for example, if you're following the local news or the regional news, or you're just looking in your own environment, you're beginning to say to yourself, well, where is the transformation? You know, where are we truly getting results from what we want to do? So my question is, drawing on some of the practical insights that were given, if, for example, the region as a group, particularly the English-speaking region, if we could just together, even if it's just once a month, do a targeted post, whether it be, both online and offline, to really communicate to policymakers, but as well as ourselves or others who need to make the lifestyle changes, for example, that this issue is important. Let me end by referencing a practical issue that's indirectly related. As all of you probably know, the CARICOM heads of government recently, I think last year, agreed on a regional target of 25% reduction in food imports by 2025. 2025 is just around the corner. How have Caribbean governments really positioned themselves to say that this indeed will be a reality 31st of December 2025? When you think of all that goes into it, we've just only looked at even one small aspect this morning so far, obesity, and not even obesity generally, but just obesity in children. So, and food, that's a broad area, particularly when you're talking about the industry and the pushback that we have that have been referenced. So to end, could, for example, just use something like that everybody agrees is critical, and they've done well to put it in a specific time frame, but it's obvious. Well, let me just say it from the perspective of the Bahamas and from the perspective of civil society Bahamas that I represent. I'm a vice president of Civil Society Bahamas. From our perspective, we don't see, and I'm talking about us having had direct consultations with policymakers, those directly with the issues. They are doing a lot, but the takeaway from us is that we don't see, based on what they're doing, how the Bahamas at this point will achieve 25 by 2025. Thank you.
Thanks, Marilyn. Sheena, Jill, Francine.
I can add about two things. So one is, so we are speaking about in terms of getting the attention of policymakers. So for us, as I mentioned, so generally, ACC has a network, a CSO network that amplifies these kinds of things constantly, on particular days, at particular locations.
I apologize, but after interrupting the speaker, but because the time is limited, I just want to be clear. It's not just getting attention. It's achieving the goal by 2025. Yes. That's the issue.
Correct. So that's it. So what I'm leading to is, so first you have to get the attention of policymakers. And they are talking, so again, across the media, you are following what they're saying in the media, and you're bringing that to the digital space. So say your prime minister, he may mention the fact that, yes, by 2025, we have to, reduce our import bill. How is he doing that? What's happening in the various spaces? These are questions that you as a CSO organization can direct to him by tagging him on social media, and more or less forcing him to respond. You're also, again, tagging media houses. So they're seeing, then they can amplify your message in lines, as digital space, or within there, again, as Francine spoke to, whether they're going to write a story on it, and they may say, well, in terms of Bahamas, civil society is wondering what's happening. We're hearing about this 25 by 25, but we aren't seeing any movement. So that's what you need to do as an advocate. You have to amplify your position, whether it's in the digital space or in the offline space. And that's constant. And what you're saying is actually regional. So again, as we said, we monitor every single thing that's said regionally by policymakers, and they're all saying the same thing, 25 by 25. But what's the action? What's happening? Is your Ministry of Agriculture and Food Security doing anything? We aren't seeing it. So you are in a very key position to amplify that message digitally, as well as engage in media to do so, to assist you in doing that. I don't know if Francine wants to add as
Yeah,
well. Yeah.
I'll just add one thing because Marilyn spoke, she was framing it with regionally, and so I thought immediately of social media. But as I listened to her, I think another key part of it is, have we engaged the journalists that are touching the CARICOM meetings? So does in every country, do we know the journalists who are in those meetings? Because they tend to be, that's their big week that they head to the Hogs meeting. And therefore that we have sensitized them enough that they are asking those questions. And I also think about, Marilyn, the importance of us as civil society, maybe having a team that is on the ground at those meetings. Because I think the impact of the individual countries and the individual politics, our voices may not be as loud, but if we are there as a crowd and we have our journalists who have already been seasoned for those meetings, I think we probably stand a better chance of engaging on the issue and creating that sense of, well, you guys are coming here every year and saying this stuff, but we're not seeing it. And if we have answers and solutions, I think we also need to bring that to the table so that civil society does not also just sound like a group that always has an issue, but also has a solution.
Great. Thank you, Francine. Thank you, Sheena. Marilyn, I think we have some food for thought there. You can let us know if you have any further comments in the chat. We have another question in the chat from Alessandra. Imagine you are a small NGO just starting in a small island state. What is a reasonable number of followers to achieve before starting to post about an awareness campaign? Jill.
Yeah, I think followers is a little bit of a misnomer these days. Your followers don't guarantee that there's no guarantee just because someone's following you that they're going to see your content. I think that it's important to create compelling content. That's the most important thing, regardless of the number of followers that you have. Because when people engage with your content, depending on the platform, it increases the likelihood that other people will see it. That's how the feed works now. It's more about someone interacting with your feed and someone they know seeing it. That being said, I think a little bit of money, not for followers though, don't pay for followers, pay to boost your content with as little as, like Sheena was saying earlier, if you do twice a week, $5 US, you will see a huge impact in terms of the reach of your content and the level of engagement with your content. But the most important thing at the end of the day is to create good content. Sheena, I don't know if you have something else to add. I saw nodding from you.
Oh, that's actually that's perfect because it's important to know. So first and foremost, in terms of those persons who represent, say, your country in the social media space, you have, huge numbers. Not everybody may be following you. So you have to reach all of those persons who are on social media who represent your country or say that they are from your country. So boosting your content allows you to do that. So you can create ads if you have, business manager, you can create ads, but you can also boost your content to reach, all the persons in Trinidad and Tobago, or as many people in Trinidad and Tobago who are on social media, and your content will reach them and reach key people as well within their circle. And that's how, as we said, and it goes back to even before. Word spreads, by just a simple conversation with one person, and that one person then passes it to another person. So in the same way on social media, the conversation, you will start to see the conversation happening like that.
Great. Thank you, Sheena. Thank you, Jill. Thank you, Francine. I don't see any other questions in the chat. Oh, Abby just commenting that they do $5 to boost on Facebook, and they've been able to reach a huge audience. So there you go. Not only just providing guidance, but it's worked. It's worked for us. Okay, thank you three so much for your brilliant presentations, for coming out on a Saturday to be with us. We appreciate you. And thank you so much. And we will share the presentations with the attendees so they have the content ready for them. Thank you. I'm inviting everybody as we move from the Q&A session to our next segment, where we're actually going to, again, see how we have used all that Jill, Sheena, and Francine would have mentioned in practice. And as I'm introducing the next speaker, I would invite you to take a little standing break, a little stretching break, because we have been sitting down for some time. So yes, please feel free to do that. So Dr. LeBlanc, she is a director, the board of directors of the Trinidad and Tobago Cancer Society, and she is going to be telling us about Take a Breath, the Take a Breath initiative. It caught my eye. She's going to speak all about the campaign, which had both an offline and online presence, just as we've heard from our previous speakers, the importance of that. And it really caught my eye because it amplified the youth voice in a very special way. One of the questions I actually had for the speakers was, what has been resonating with policymakers recently? And I think all of them would agree with me that amplifying what youth have to say about a particular topic, specifically in the health space, has garnered great attention from policymakers. And so with that, Dr. LeBlanc, it is my pleasure to hand over to you, and we're looking forward to your presentation.
Hi, good morning, everybody. Thank you, Danielle. Thank you so much for inviting me once again in the capacity as member of the board of directors of the Trinidad and Tobago Cancer Society. This is an amazing thing for us to be able to share our experience in our anti-smoking and anti-vaping campaign in collaboration with our partners, Scotiabank Foundation. As most of you know, the Trinidad and Tobago Cancer Society is the national voice against cancer in Trinidad and Tobago. In addition to promoting prevention by screening for early detection, we also are very strong when it comes to education and creating greater awareness. And it's a major priority for us at the TTCS. Our partnership with Scotiabank Foundation spans over 1 decade, and it was first to bring awareness to breast cancer screening in women across the country. However, in the last 5 years, when we saw the increase of vaping and the ineffective implementation of the Anti-Tobacco Act, they decided to increase their support to our cause for education and awareness when it came to no smoking, no vaping. Since the TTCS has been instrumental in the establishment of the Anti-Tobacco Act of Trinidad and Tobago of 2009, it seemed natural for us at the organization to now focus our attention on campaigns that tackle the current issue of youth smoking and vaping head on. Our campaign, Take a Breath, was launched in 2020. And since then, we have been engaging in an intense drive to bring more awareness to young people on the harmful effects of smoking and vaping. To keep the information relevant and to keep engaging them, we create new content every year. Hence the reason the theme for this year's campaign is, don't follow the cloud, lead the crowd. So I'd like you to see 2 of our videos that we are now going to launch soon.
Let's talk about this silly fascination with the vape cloud. It's so crazy that we know that behind those puffs lies a dangerous game with your heart. Vaping isn't about the tricks, nor the flavors. It's about the dangerous impact it has on your body. And with each deadly puff, you increase your risk of a heart attack or stroke. Now, why would anyone take that risk just to fit in? Don't follow the cloud, lead the crowd. A message from the Trinidad and Tobago Cancer Society and the Scotiabank Foundation.
And the next video.
Ever wonder what vaping does to your brain? It's more than just blowing smoke. Nicotine exposure during your crucial adolescent years can wreak havoc on your brain's development. Think about it. Every puff you take is a step backward. Your brain, the powerhouse of your potential, deserves better than to be clouded by harmful chemicals, and your future is too bright to be dimmed by clouds of vapor. Don't follow the cloud, lead the crowd. A message from the Trinidad and Tobago Cancer Society and the Scotia.
Excuse me, was that last video, was it supposed to be a video?
But it's okay. I'll continue. It's fine. So thanks, Doriel. So our engagement extends beyond social media campaigns, and we actually went into the schools across Trinidad and Tobago, where we take the opportunity to interact directly with students, listen to them, and understand their lingo and speak their language. Our presentations are designed for participation and interaction, and we have seen an incredible involvement from students all eager to learn and to spread the message. Additionally, students are encouraged to become advocates themselves for other young people. So we go with peer-to-peer advocacy, amplifying our message and the impact within their own communities. Public relations through traditional media also serves us very well in taking our message to a wider population. This includes radio and television interviews, newspaper articles, press releases, and of course, presentations such as these with Healthy Caribbean Coalition. As an NGO, we recognize the value of collaboration, especially with organizations whose goals are closely aligned. The relationships we have developed and nurtured along the way with organizations such as the Scotiabank Foundation continue to be a valuable asset, not only for our partnership, but also for communities around the country and regionally, thanks to you. We seek to engage and serve in the fight against cancer and also lifestyle modification. What lessons, you may ask, have we learned and practical takeaways from this campaign? First of all, long-term partnerships. The value of a long-standing partnership, such as with Scotiabank Foundation, demonstrates the importance of consistent support and collaboration in achieving campaign goals. Strategic focus. Recognizing and aligning campaign efforts with relevant issues like youth smoking and vaping allows for a more impactful intervention, which will address pressing societal concerns. Adaptability and relevance. Regularly updating our campaign content and themes, like the annual refresh of the materials for the Take a Breath campaign, ensures that information remains current and engaging for the target audience. So you may have noticed that this year, Don't Follow the Cloud, Lead the Crowd, you would notice that we used AI. I immediately asked our marketing team, why are we using AI? And I got a good response, which is very great. She said, it's built on the more trending AI style, even with the images, as you would note. So then we've used local content all for the past 3 campaigns, but by using the trending AI, then we will then bring in the local content as we move along with this campaign. Innovative messaging. Crafting compelling and relatable campaign themes such as Don't Follow the Cloud, Lead the Crowd, can effectively resonate with the audience and drive behavioral change, because we want the youth to be the leaders of tomorrow. A multi-channel engagement. Utilizing a mix of online and offline activities such as social media, campaigns, radio, TV, everything we spoke about today, direct face-to-face school interactions, thanks that we can go back into schools, allows for a broad and diverse outreach to reach the different population and in different segments of the population. Direct interaction with the stakeholders. Engaging directly with the school and the students and the teachers and the principals fosters a meaningful interaction and promotes active participation. It increases awareness and understanding of the campaign and the messages that we want them to get. Youth advocacy. Encouraging students to become youth advocates for the cause empowers them to amplify the message within their own communities, extending the reach of the campaign as well as its impact. Traditional media outreach. Leveraging traditional media channels such as radio, television, and newspapers alongside the digital platforms expands the campaign's visibility and accessibility to a broader audience. I cannot say enough about how this has transformed us advocating and getting the message across. But I must say that there's a lot more work to be done, because we're not seeing enough of an impact in curtailing the introduction of vaping into our society nationally and regionally. However, we will not stop, and this is our campaign, and we will keep pushing on, and we are grateful for the experience. Thank you very much.
Fantastic, Dr. LeBlanc. Congratulations again. It's so exciting to see the new material, which looks great. And I was wondering if it was AI generated. So again, being strategic, keeping with the times, I would encourage Dr. LeBlanc, if you don't mind, even throwing in your campaign material from the past, just so that everyone can see as well. I think that would be helpful, but fantastic. Really looking forward to seeing how this stage or phase of the campaign unfolds. Again, I just wanted to spotlight the long-term partnerships that you mentioned, because going back to Sheena's point about who we engage with to amplify our messaging and ensuring that we are, well, especially for us in the health space, engaging with partners that are health neutral or health promoting. Scotiabank, that's one of the things that attracted me to the campaign was Scotiabank stepping up to support such an important initiative and doing it. It seems like it's a multi-year effort. So really congratulating Scotiabank, and again to you all, that speaks so highly of the relationship that you've nurtured with them. And the online offline, I was thinking back to both Sheena and Jill's comment on who the target audience is, and one of your target audiences is the young people, going straight to them. I'm glad that you mentioned that you go to speak to them, but you're speaking with them. Your emphasis on how you speak with them it's participatory. So really excellent. Thank you so much, Dr. Blanc. If you don't mind sticking around for a couple more questions. As soon as we are done with our next and final presentation, we have our second case study. So we just heard from Dr. LeBlanc. And again, we're seeing how a lot of the strategies that we've learned from our speakers previously are being implemented. And now we're heading into your Sweets Enough campaign. And it's my pleasure to introduce Abby Bejo. She is who you would have met earlier, Program Director at Lake Health Director of Program Management at Lake Health and Wellbeing. Abby is going to speak about the Your Sweets Enough campaign and the multi-pronged approach that they would have used to amplify their messaging. Abby, over to you.
Okay, all right, sorry, it took me a while to unmute myself. All right, thank you so much, Danielle, for the introduction, and thank you so much for the opportunity to share with you about our Your Sweet Enough project and campaign. And so really, what I want to do is really just share with you how we've used some of the lessons that we've learned from the speakers today and in the previous sessions around branding and marketing to really amplify our messaging around Your Sweet Enough, and to use marketing, I guess, in a sense, as a bit of an advocacy tool. And so for those of you that don't know, Your Sweet Enough project really is a sugar sweetened beverage advocacy project. And so what we're doing with this project is that we're aiming to educate the public on the health impact of the overconsumption of sweetened beverages. We're aiming to encourage the public to consume fewer sweetened drinks and to drink mostly water. And when you think about what Jill mentioned previously, this is really the first sort of phase, the number one on her diagram, where we're building public awareness of our issue. And the idea is that as we build public awareness, we're going to build public support for action on sugar sweetened beverages and really bring the public along with us as we advocate for this issue. And in essence, also convert the public into advocates. And we've done that in a number of ways. And we've actually developing a youth health advocate program where we're bringing youth advocates along who we've educated about these issues to now become advocates. And so the third aim of our project really is to advocate for policies, particularly a sugar sweetened beverage tax that reduces the public's consumption of sweetened beverages. So again, when we're thinking about effectively reaching our target audience, we have to first think about who is our audience. And based on our previous objectives, our audience is the public because we're trying to educate them about this issue, but also policymakers because we're trying to encourage them to introduce policy. So then the question is, how do we effectively reach them? And we really thought about the idea of using branding and marketing principles to reach our target audience. So what we had to do when we think about branding, first of all, is that we felt that we had to create a really strong identity for our campaign. So when you think of marketing, they tell you about the P's of marketing, and I'm just going to touch on a couple of the P's of marketing. So the purpose, we already have that already. I spoke to you about the objectives, and really the purpose overall is to reduce the public's consumption of SSBs. So when we're thinking about the purpose and building our identity, we're building our identity around that. When we think about positioning our campaign, really we're positioning our campaign to be a trustworthy public health campaign. And then when we're thinking about the personality in terms of our identity, we're thinking, okay, we want to be informative, but we also want to stand out. We don't just want to be a boring public health campaign. So we've added a touch of humor, a touch of fun, and a touch of creativity to that. So in terms of building the identity, there are certain things that we have done. So we've decided to think about a name for our campaign that's concise, that's catchy. And we went through a couple of names, and of course, You're Sweet Enough came up, and that sort of seemed to resonate a lot with the public. You know, they play a lot with it. You're sweet enough, I'm sweet enough, we're sweet enough. So it really sort of captures the audience in that sense of it being a bit of a fun name for a campaign. We also had to think about the color when we were thinking about identity, and we thought of different colors, and we landed on blue. And the reason we landed on blue was severalfold. Blue really to us would bring the image of water. We're encouraging the public to drink more water, reduce your sugar sweetened beverage consumption. And so we thought about blue in the sense of really bringing home the message of water. But also when you think about what blue also represents trust. It represents loyalty. It represents wisdom. It represents sincerity. And so we also wanted all of those messages conveyed. We also decided to create a logo for the campaign. So you can see this is our logo for the campaign. You're sweet enough, it's blue. We have the splash of water. We have this little sugar spoon as well. So all of this really just to convey the message of what we're trying to get across with You're Sweet Enough. We have a website for the campaign. So it lives somewhere. People know where to go. We can signpost them to the website. And then we have a very catchy jingle for the campaign, which really has been the foundation of the work that we've been doing. The campaign is catchy. We had a popular singer voice the jingle. We use the jingle for a lot of things. We use it for a lot of outreach work. It's been played on the radio. We use it as background noise for a lot of the things that we do. And so the jingle played a really important part of that. We also try to keep the message as simple as possible. So really our message is, SSBs are bad for you, drink more water, we need action, i.e. we need the policy. So at the very basic level, really, our campaign is saying to you, just drink some water, really and truly, but really we need the action as well, we need the policy. So when we think about our marketing in terms, so that was the branding side of it, developing our identity, then we had to think about the marketing. So how are we going to stand out in this very busy and crowded environment? And one of the ways that we decided to stand out was to have a long campaign. So we had the first phase of that campaign was actually 9 months, which is quite long for a campaign. And the idea was that we wanted to have enough time for us to reach the public and for the public to digest that information. Because I think there's the statistic that someone needs to hear your message 6 or 7 times before it resonates and they take action. So we wanted that to be enough time to reach the public and then for them to digest the information. We also wanted to saturate the media. So we have animations, and these were aired during the news almost every day for 9 months. So we had a lot of airtime. Our jingle was played on 3 radio stations every day for 9 months. And then of course we did a lot of social media work. And so when it came to marketing, we really pushed with this campaign. We also created a variety of material, and I'm going to go through some of those with you. So we created animations, influencer videos, discussion series, billboards, lots of other things as well. We did lots of it. We did the press releases, flyers, we did merchandising. So we did the t-shirts, we did badges, pull-up stands. We just did the whole shebang. We also use a variety of platforms to get our message across and to reach our audience. So we have the website, we use social media, we use TV, we use radio, did a little podcast, we did digital billboards, we have film screening events, webinars, interviews with experts, panel discussions. So we really just tried our best when it came to the marketing to really be out there. So this is just some of the material that we use. So here is just like some screenshots of some of the animations that we have used. And as you can see, we have the logo on every single animation. So that it's very clear that these animations are related to the You're Sweet Enough campaign. Each of the animations we use them to educate, to stimulate discussion, to reach different types of audiences, to improve engagement, and to really change the hearts and minds of people, and hopefully to also stimulate people to think about behavior change. So each thing had a purpose. So for example, this animation was more about providing facts and figures and educating. We had this animation which used humor to convey the message of the link between SSBs and overweight and obesity. This one was a hit. It was like Coke was talking to water and they're having this conversation. So it was funny, it made people laugh, but they got the message. We had another animation here that conveyed the message about the impact of SSBs on children. So we used like an animation that used superheroes and characters. So we had Captain Splash, really to get that message across. And then we had Meet the Wilberts, which was like an emotional journey where we used humor, sadness, and hope, really to show how SSBs and unhealthy diets affect families. We then also used some visualization sort of animations just to really show people how much sugar is in an SSB. And we had like an animation with all the like sugar coming in so people could actually visualize that as well. And as I mentioned before, you know, our logo is on everything. So again, people can really identify that this is something from the You're Sweet Enough campaign. We also did a range of events. Like I mentioned, we did panel discussions, we did webinars, we were on the radio. Every month we had a slot on the radio. And as you can see, the logo prominently everywhere as well. So again, that's all about the branding and the marketing and making sure that people identified our campaign. We did, you know, interesting public events. So here we're doing a no sugar sweetened beverage challenge, encouraging people to drink water and no SSBs for a whole week. And again, you see us making sure that people are branded. So they're wearing You're Sweet Enough t-shirts. So again, really just to build, in essence, that brand loyalty. You're part of the club. You're part of the You're Sweet Enough crew. Again, we did something similar with the schools. So we did a You're Sweet Enough dance competition. The young people had to learn a dance, and the music they used was our jingle. So again, that's the branding. So they had to choreograph or learn the You're Sweet Enough dance and then perform it. We had the public engagement, public vote. And then again, we were able to engage sponsors. Again, people coming on board with the You're Sweet Enough brand. So we had Ross University donating the prizes. You see the promotional material, the You're Sweet Enough logo, very prominent as well. So we use a range of different ways to really get the message across around the need for action on SSBs. We did a discussion series. So here we're engaging with experts from across the fields of different health fields, getting them involved in the conversation, using their expertise to get involved in the conversation. And again, you can see our logo being used throughout all of this. Again, you know, really trying to make sure that our brand for the campaign was really strong. We also had influencer videos. So we engaged with key influencers. Dr. Pierre is the president of the Medical and Dental Association. We had a journalist, we had a business manager, we had a pastor coming on board to communicate that message as well. So we had all sorts of titles: My Sweet Enough Story, Alexa, am I sweet enough? You're sweet enough at work, home, or play. Take care of this temple, you are sweet enough. So again, just really getting that message across. We also engage various different stakeholders. So now this is more like the policymakers. And we've done that in a number of ways, but I'm not going to go through every single thing. So for example, we had a webinar with the Bar Association. So that's trying to engage lawyers who are going to be some of the persons writing the drafting instructions. They're going to be around policy and the legislation side, and also implementing policy and legislation. So we had a webinar with the Bar Association where we invited lawyers to attend. It was very well attended. So in that way, we're engaging a completely different audience with regards to our campaign. We also engage young people. So that's the St. Kitts Nevis Youth Parliament Association, and got them to debate about sugar-sweetened beverages. We had workshops for civil servants from across the different ministries talking about sugar-sweetened beverage policies and how it might impact them and how they can support the policy. This is to indicate that we wrote to the cabinet around sugar-sweetened beverages. And then we also engaged with civil society, so other NGOs, building their capacity in terms of how to advocate and get involved in projects around sugar-sweetened beverages. So really, when we're thinking about effectively reaching our target audience, our lesson and what we learned from the whole process is that we just had to be everywhere. We had to have a strategy in place, and then we just had to be everywhere. So we had to do the animations, the influencer videos, the jingle, the dance competition, the billboards, the flyers, the press releases, right to government, policy briefings, stakeholder engagement, web series, panel discussions, webinars, monthly radio talk show. We just had to do it all and be everywhere so that we could ensure that our message got out there and that we could start to influence people in terms of their behavior, but also in terms of coming on board with us to advocate when it came to advocating in terms of policy makers. So then the question is, did it work? You know, we do all this work, we throw it all out there. Did it actually work? So for us, it was very important for us to measure the impact of our campaign. And so we did that through a public opinion survey. So what we found was that we did a survey, and over half of our survey population had seen that our campaign. So I think roughly over 50% of people saw the campaign, which for us was really good because when we compared it to some other campaigns that had been going for longer, so things like SKN Moves, things like other campaigns, more people had seen our campaign than many other campaigns. I think the only other campaign they'd seen more of was just general breast cancer awareness, which I think for us was a success. So now of the people that saw the campaign, 79% of them said that it improved their knowledge of the link between SSBs and obesity and NCDs. And then 78% of people who saw the campaign said that the campaign influenced them to reduce their SSB consumption. So for us, we do feel that it did definitely work. And as we go into the next phase, or as we went into the next phase, which is now more about engaging more with the policymakers, we have had all of that momentum of engaging the public, raising their awareness, so that we would now be able to have that public support for action and then bring the public with us as we advocate for the policy. So in a nutshell, just to say, by using all of these branding and marketing techniques that we have learned, we were able to effectively reach our target audience with our key messages. And so for us, we do feel it's really beneficial to try and think about branding and marketing in the NGO sector because it can be very effective. Private companies and businesses use it very effectively. And so as NGOs, we also need to use these techniques very effectively to advocate for change. So thank you so much. And I hope I haven't gone too much over time, but thank you so much for listening.
Brilliant. Thanks, Abby. And such a great way to end what you had, Abby, as Lake Health and Wellbeing envisioned as a branding your NGO or branding and identification session, because you tied in everything so well. The importance of branding and how that your branding as Lake Health and Wellbeing, but also the branding of your campaign and how that strengthened your messaging. You literally saw your Sweet Enough everywhere, and how effective that was. What I really liked that you highlighted was everything from the colors that you used and the meaning behind those colors, that you had a prominent logo. I think that's something that we probably in the CSO space maybe take for granted, is not just having our organizational logo, but if you really do want a campaign to go far and wide, it might be worthwhile considering having your own campaign logo. The length of your campaign, the jingle, which was, again, Abby, I don't know if you wouldn't mind just popping the website of the campaign into the chat, as well as Dr. LeBlanc when you have a chance, just so that people can see what really was entailed in your various campaigns. So I am going to pause there because I can go on and on about our last two speakers and the fantastic work that they're doing, and open the floor for any questions. So Dr. LeBlanc, inviting you back on, and any questions we have. Let me see in the chat. I might be missing something.
Oh, I think I see a question for me.
Go right ahead.
So it was from Alessandra. I think it was where did I see? Sorry, I've now lost it.
I think it was when the campaign started.
Oh, yes. Okay, that was it. Yes. So so our campaign started, that the core sort of educational side of the campaign started in 2021. And so it's been ongoing basically since then, but we've transitioned now to more of the policymaker side of it all. So trying to engage more with the policymakers, but the public education part, which was the first phase, that was 2021 and into 2022. So we were on the radio, we were, radio, social media. We're still doing some public education, but the bulk of the public education was in 2021.
Thanks, Abby. And I actually do see Marilyn has a question. Marilyn, go right ahead.
Thank you very kindly, and I agree with everyone. A wonderful presentation and insights into how an effective branding and marketing campaign was achieved. You partly answered the question I wanted, Abby. Firstly, I wanted to find out whether now you were going to have a specific follow-up campaign focusing on policymakers, and you confirmed that.
Yeah.
But my added question is, what precisely will be the the deliverables, the results, what you want from the policymakers? Will it be a specific law banning sugar sweetened beverages? Will it be changing labels? What particularly will you be targeting? Thank you.
So thank you for the question. So we'll be basically encouraging the government to introduce a sugar sweetened beverage tax of at least a 20% tax. We're also going to be encouraging the government to introduce a school nutrition policy, which would also, and a part of that policy would be to also restrict the sale and marketing of SSVs in schools. And then we're also encouraging the government to introduce front of package warning labels, because we think that's also very important, because as you know, with front of package warning labels, they very easily educate the public about foods that are high in sugar, salt, saturated fat, and also foods that have trans fat in them. So we'll be advocating primarily for the sugar sweetened beverage tax, but we believe that there are other supporting policies that will help, and that is a school nutrition policy and front of package warning labels. I hope that answers your question.
Thank you. It certainly does.
You're welcome.
Dr. LeBlanc, if I wouldn't mind, just as Abby kind of clarified what her kind of clear call to action is, if you wouldn't mind also in your context, so we're talking about tobacco control, if you wouldn't mind clarifying what your main aim is. Oh, you're on mute.
It was fun talking to myself. So our main aim in the campaign is to bring awareness to the youth, because we do believe strongly that if they are taught and educated and we bring that awareness to them on the harmful effects of vaping and smoking, then we can then hit it from the aspect of consumerism. So if we decrease consumerism, then no matter how they try to manipulate and trick them, we will see a decrease in consumerism. Also, by doing this campaign and engaging the different schools and going into them, we hope that policymakers, namely health and education and trade, will then look at the policy, listen to us, and effect, because it's just minor tweaks on the actual act that we have there to make sure that vaping is controlled and that we really help the population. So it's twofold. Yes, the main one is let's hit the students, let's get them educated, bring awareness, reduce consumption, and then also policymakers, wake up. We're educating them, and we need you to do your part. If you're going to put your money where your mouth is, basically, and act how you're supposed to act. Yeah.
Absolutely. Thanks, Dr. LeBlanc. Thanks so much, Francine, for hopping on. I was just going to echo your comment in terms of both Abby and Dr. LeBlanc's campaigns being excellent. And again, I just wanted to put a plug in that if these are areas of interest, we as CSOs work better together. And so I would highly encourage you to get in contact with Dr. LeBlanc, get in contact with Abby, again, just so we can work together and amplify our voices as well. And also to get in contact with the Healthy Curbing Coalition as well, because we work across these areas. I'm just seeing if there are any other comments.
And Danielle, just to let you know, we will send you the Take My Breath Away campaign videos, so you can put those up. But I want you to if y'all just pay attention to our social media and feel free to share up our current campaign once we launch it on social media.
Perfect. Would you mind just popping your social media details, Dr. LeBlanc, if you can? If not, we can also share via email. Okay.
Big things, but okay, I'll do it.
So much. I'm just reading Alessandra's. As a result, I was happy to see my child's daycare actually implemented a water day. Yeah, all of these steps count. Okay. Any other questions? Okay, you all have been a fantastic audience. Thank you so much. It is my pleasure now to hand over to Teresia Herbert. Thank you so much to Abby and Dr. LeBlanc for their presentations and their responses. Then I'll hand it over to Teresia for closing. Teresia, over to you.
Hi again, everyone. Wow, we had such amazing presentations today, and it was such a great follow-up to our first session. I hope you guys were able to learn some tools, some tricks from this. As asked in the chat, we will be sharing the slides in a follow-up email. So I just wanted to thank Sheena Warner Edwards. So she sort of went over exploring social media and the digital strategies for NGOs. So we talked about identifying your target audience, creating unique content tailored to your audience, analyzing content, and increasing engagement via influencers, and most importantly, possibly is having a clear call to action. Jill from the Global Health Advocacy Incubator, she would have went over the content and impact, and what stood out for me is her statements about advocacy being about policy, right? And so making sure that there's sort of a end result that we're aiming to, and then that framework that she provided us, going from marketing towards advocacy, via creating that sense of urgency. I thought that was very useful to us. Thanks to Mishran for bringing up that question about WhatsApp, and the role that WhatsApp can play in advocacy. I think in the Caribbean setting in particular, that could be a very valuable tool for us. And then thank you to Francine, who really sort of, from a media, through a media lens, went through how we should be going about building and maintaining relationships with media, and how that could sort of feedback into the message that we're trying to get out. And so that was sort of the theory of it, right? And then it was really great to have the case study from both Trinidad and St. Kitts, the anti-vaping initiative, Take a Breath initiative, that Dr. LeBlanc presented. That was really amazing. And it's really great to know, to be able to see some of the work that's happening throughout the Caribbean. And so things that we could sort of mimic or, have implemented in our own countries. From the standpoint of the You're Sweet Enough, with Lake Health and Wellbeing, that one I would have been more familiar with, but it was really great to hear the intentionality that went into that campaign. Seeing it is one thing, but really hearing the background and the thought that went into it, that was really ideal. And then the last thing that would have stood out for me was sort of the measure, being intentional about measuring the impact that we have. So once again, I would ask for the organizations present some have already started posting your social media pages in the chat so that persons can keep up with the work that you're doing. And as we spoke about, today and during the last presentation, be able to expand your reach, expand your network. This is sort of a part of that. And then thank you to Danielle, who did a great job of facilitating. So if there are any other questions or any other concerns, we'd just like to wrap up today. Thank you again to everyone who signed on for the feedback that we had. It was really invaluable. And we hope to do more of these sessions and to, as a region and really globally, help to support each other, support the work CSOs are doing, and work towards serious change when it comes to preventing and treating NCDs in our areas. Okay, is there any other last minute thoughts or any sort of feedback? Okay, if not, that's it, right, Danielle? Okay, so everyone, we'll take a little while before we cancel so that we can get the information for the chat before we close the meeting. But have a great Saturday, and make sure you're sort of following us so that you can be kept abreast of further workshops and seminars. All right, have a great weekend, everyone. Thank